This CARE Student Assistance Program orientation is brought to you by ACI, a specialty benefits corporation. ACI is also the provider of the Employee Assistance Program to all CCI employees and family members. Feedback is important, and we look forward to your ideas and comments. The means of communicating your ideas and comments will be identified at the end of this presentation. Today's presentation is designed to help faculty and staff understand the CARE Student Assistance Program, as well as how and when to use CARE. There are a number of benefits included in the Student Assistance Program. This program is made up of two components, the mental health aspect and school life resources. These benefits include telephonic assessment, legal and financial consultations, childcare and eldercare assistance, as well as additional tools for daily living services. Information on these additional services will follow. Think of CARE as an extension of student services. CARE is designed to provide students with the resources, guidance, and support needed to better cope with everyday challenges and achieve academic success. We all know college could be one of the most exciting times in life, but could also be one of the most challenging. And sometimes the stress and pressures of school and everyday life can become overwhelming, and finding the time to deal with these issues while juggling schoolwork and other responsibilities may seem impossible. The CARE Student Assistance Program is here to help. Why use the CARE program? The CARE Student Assistance Program is available to help with any concern or problem affecting behavioral health, well-being, and most importantly, academic performance. Now, students who hear of this program may tend to associate it with just mental or emotional health. However, the CARE program is a bit different, and that it offers mental health services as well as school life and tools for daily living resources to assist students and family members. So when a student or family member is having trouble managing or coping with a personal or school-related issue, they can utilize their CARE benefits to help. CARE can provide mental health assessments relating with issues like managing stress, whether that's at school, at work, at home, or in life in general, family or personal conflicts, such as parenting struggles, roommate issues, or family fights, relationship issues such as communication, separation or divorce, or the single life, staying focused and motivated, whether that's at school or in life in general. Substance abuse includes addiction to alcohol, drugs, gambling, or even the internet. Depression and anxiety, whether it's school-related or personal. And grief and loss, such as the loss of a loved one, the anniversary of a death, or even a pet loss. Balancing school and life. Now, we understand that students have a lot to deal with more than just schoolwork. And that's why the CARE benefit provides services that can assist with referrals for childcare, eldercare, legal and financial consultations, so that students can stay focused on school. Please note, the CARE Student Assistance Program is for emotional and life issues. School resources should be utilized for academic performance issues related to tutoring, learning disabilities, study skills, and more. The CARE Student Assistance Program is a short-term approach for assessment, referral, and problem resolution. Students and their family members have access to free telephonic counseling with experienced mental health professionals who are available to help with any personal or school-related issue affecting daily life and academic performance. A simple phone call or email starts the process. Here's a frequently asked question. What if the student needs more? Additional phone counseling sessions are available as needed. But of course, there are some problems that will require additional support beyond telephonic counseling. And in those cases, the goal is to provide immediate support, assess the student or family member's needs, and then to provide them with a problem resolution plan, which includes connecting them with the appropriate resources. Should a student or family member need help beyond the CARE Student Assistance Program, the ACI Council will refer them to the nearest campus, community, or other resources that will best meet their needs. Balancing school and life. Most students and family members associate a student assistance program with just mental health, but this is just half of CARE's program. In addition to the mental health aspect of CARE, students and family members also have access to a comprehensive school life and tools for daily living benefit with plenty of resources and viable information. These benefits include childcare and eldercare referrals, legal and financial consultations, and additional tools that help support a student's daily living situation. CARE assists students and their family members with childcare referrals so that they don't have to take breaks or time away from school. They can simply contact CARE and let us know what kind of childcare services they're requesting, and our representatives will do all the research for them. We can provide them information via email, fax, or phone in a timely manner. As a faculty and staff member, you should be familiar with these benefits and use them to support students in their daily life issues. CARE can help on such things as finding low-cost childcare, locating new daycare centers, or even locating summer camps. These are all things that impact your students and can add stress to their daily lives. Let CARE help. CARE also assists students and their loved ones with Eldercare Referrals so that they, again, don't have to take time away or breaks from school. They can simply contact CARE and let us know what kind of eldercare services they're requesting, and our representatives will do all the research for them. We can provide them information via email, fax, or phone in a timely manner. As a faculty and staff member, you should be familiar with these benefits and use them to support students in their daily life issues. Students who are helping out their parents or grandparents with an eldercare issue can be under a lot of added stress. Let CARE help. Keep in mind that this program can also be used by the family member, so the student can assist their loved one just by offering the CARE program. The CARE Student Assistance Program includes unlimited consultations with a financial planner or legal attorney regarding most issues. Students and their family members can speak directly with a financial planner in regards to issues like credit consolidation, budgeting, taxes, and more. This service is not for providing monetary or financial assistance. Students and their family members can also speak with a legal professional in regards to issues like landlord or tenant disputes, divorce or separation, or even child custody. This service cannot be used to ask any kind of employment law questions or to register complaints against the school. In most cases, a student or family member just needs some additional information from a professional to make an appropriate decision. We've also found that 90% of our calls are handled over the phone without further referral needed. Tools for daily living. Tools for daily living is assistance for students and their family members for the things that may come up daily and get in the way of balancing school and life. Students have contacted the CARE program for resources, referrals, and information on locating low-cost laptops, financial hardship, housing resources, locating low-cost prescriptions, and even help in finding a job. As a faculty and staff member, you know how many issues may be pulling your students' attention away from their studies. So remember to offer the CARE program to support your students with daily tasks. This is a valuable support tool for all of your students. How to use the CARE program. You can refer students to the CARE program when you notice that they may be in need. Now up to this point, we've talked about the benefits available for your students. We'll now cover how you as faculty and staff who interact with students on a daily basis can use this program as a resource and additional support tool. We're here to make your job easier. You can consult with a counselor on a wide range of issues, such as how to approach a student. If you have a student who is off track and you think that there would be more to the story than just academic struggle, a counselor can advise you on how to best approach that student. Communication tips. CARE can assist you by taking the lead with a student. Now you can't solve all of their problems, but we're definitely here to help with many things. So if you want some feedback on reaching out better to a student or discussing their behaviors, call and speak to a CARE professional. Questions about the program. You can call and consult with an ACI clinician for any clinical related question, or speak with an intake operator for general program questions. Identifying signs and symptoms of concern. CARE counselors can assist you by making you more aware of key signs and symptoms of troubled students, whether they attend on campus or online. In addition, a formal referral process is available for more serious student concerns. Please contact your campus director for more information or visit your virtual folder. Oftentimes, students don't seek out or receive the help they need until a problem has escalated out of control. And to help those students overcome whatever issues may be getting in the way of their schoolwork or focus in class, the CARE program should serve as a prevention and early intervention strategy, ultimately helping students succeed to graduation. Be proactive. Look out for signs and symptoms that a student may need help. In your role, you may notice poor performance, frequent absences, consistently late assignments, or concerning behavior or statements. Listen. What is the student's reasoning for poor performance? Is it personal or family related? Is it a practical issue, such as the internet not working, their computer crashing, or their babysitter fell through? Is it just life in general, perhaps being too stressed out or having too much on their plate or not enough time? Or maybe crisis related, such as a personal loss, a housing crisis, or legal troubles. And maybe they'll never really tell you what's going on. And in this case, you can offer support, encourage students to call the CARE program, speak to a counselor, and take advantage of the resources available for them to help them balance school and life. Here are a few examples of some real student issues. Can you identify the types of problems in these situations that the CARE program can help with? Number 1. Claudia turns in an assignment late for the third time, and when you question why, she states that she was kicked out of her parents' home. The CARE program will provide Claudia a housing referral that will best meet her needs. We may also want to connect her with a mental health counselor to work out her relationship issues. Number 2. Bernardo misses 2 weeks of class. He later tells you that he was arrested for a DUI. The CARE program will refer Bernardo to a legal and financial representative to help him with his DUI situation. We may also want to refer him to a mental health professional because he may have a potential substance abuse issue. Number 3. Cynthia tells you that she may have to drop your class because she doesn't have reliable childcare. We'll be able to provide Cynthia a childcare referral that best meets her needs. We may also want to connect her with a financial planner to talk about budgeting. ACI prides itself in providing high-quality customer service, and that's why the CARE Helpline is available 24/7 for any crisis or urgent matters. ACI has live operators after business hours who will assess the situation with a caller and will make the appropriate referral, whether that is to take a message and have an intake operator call them the next business day, or, in case of an urgent or crisis matter, transfer them to a licensed mental health professional. For any life-threatening cases, such as suicide or where someone wants to cause harm to themselves or others, please call 911 or call their nearest emergency center. Here are some frequently asked questions. Where is ACI located? ACI's corporate headquarters is in San Diego, California. What are the business hours? General business hours are Monday through Friday, 7 a.m. to 5:30 p.m. Pacific Standard Time. Who is covered under the CARE Student Assistance Program? CARE provides services to all enrolled students, their family members, and significant others, regardless of the location or whether they live in the same household. The CARE benefit is available to assist a student in addressing problems that may take away from his or her attention from school. So if a loved one is under stress or needs some assistance, then CARE is here to help address those needs because their problems may affect the student's academic performance, attendance, motivation, and so forth. So here's an example. If a student is enrolled in a campus in California, but they have a parent or family member in New York, they too are covered under the CARE Student Assistance Program. They would simply need to call the dedicated CARE line and inform the intake operator that they have a family member that attends the campus in California and they would like to utilize the CARE services. If they are unsure as to what exactly they're entitled to, they can also call the dedicated CARE line and inform the intake operator that they just need some program information. Nowadays, many students have family members that speak a variety of different languages, such as Spanish, French, Tagalog, German, just to name a few. ACI has trained professionals to take calls in a variety of different languages. In addition, ACI utilizes a translation service that has access to over 150 different languages to help better serve. ACI also provides clinicians that are culturally sensitive and are available by telephonic assessment if needed. All information shared with the CARE Student Assistance Program is 100% confidential and privacy is protected by state and federal law. Utilization reports are provided to school officials on a quarterly basis and contain absolutely no personal or identifying information. Critical Incident Stress Debriefing, or CISD Response. It's really difficult to determine the impact of an unexpected and traumatic event, and people can respond to the same traumatic event in several different ways. So in the event of a crisis, ACI can have a mental health professional be readily available to help students and others cope. For ACI, a critical incident is defined in this context as a non-campus or school-related event which is extraordinary in nature, with the expectation of producing significant reactions on the part of victims or those either directly or indirectly impacted. Some examples of CISDs include death of a student, faculty, or staff member, severe injuries, prolonged or severe illnesses, school violence, or any other traumatic event that impacts the student body. The CARE Student Assistance Program is here to help students succeed to graduation. The school is invested in student success and provides this program to students and family members so that they can overcome personal and school-related problems and stay focused on academic success. It's important for faculty and staff to have daily interaction with students to be aware of student needs and how the CARE program can assist them. The CARE program is also available as a resource tool to assist and support faculty and staff. Feel free to call the CARE line for consultation and assistance in dealing with students. Thank you for your time and attention today. We look forward to your questions, comments, and feedback along the way. The program is currently in effect, and you should have access to promotional materials at the Faculty and Staff Virtual folder. Feel free to call us for any needs regarding the CARE Student Assistance Program.